Today at Alameda East, the interns will make some tough calls. In ICU, a dog with a sudden paralysis puts Dr. Eric Anderson's skills to the test.
There was something wrong with their entire nervous system.
And a boxer puppy's mysterious vomiting forces Dr. Kevin Drygas to make a tough decision.
Time to get off the fence, basically, and make a diagnosis.
And as the internship reaches a midpoint, the young doctors take stock in what they've learned and prepare themselves for greater challenges to come.
We're going to expect more of them and hold their feet to the proverbial fire.
The internship at Alameda East is designed with one goal in mind: produce the most skilled and confident doctors in the profession.
I look at it as a journey. At the end of their journey here, we want them to leave with more clinical information, more confidence, a greater ability to perform the duties of a good clinical veterinarian.
Now, as the year-long internship reaches a midpoint, the young doctors must become more confident, more independent. They must now see more difficult cases and make some tough calls.
All right, sweetie.
In ICU, intern Dr. Eric Anderson's diagnostic skills are about to be put to the test.
Let's try to get her to stand here for a second.
His patient, Rosie, an 8-year-old chow mix who suddenly lost the ability to walk or even stand.
I don't know. This was weird.
I came home and found her lying on the ground in the backyard, unable to move.
She was paralyzed, basically, unable to stand, unable to walk. It was a little strange because most of the time when we see dogs in that type of condition, they're pretty sick or they're injured pretty bad. With Rosie, she seemed pretty much normal otherwise. She was bright and alert. She was non-painful. It was pretty odd. No idea, apparently she's very, very weak. She won't put any weight on any of her limbs here. I don't know about her. What do you think, Rosie? Tell me what's going on.
Eric can find no evidence of injury on physical exam, so he goes to speak with Rosie's owner. He hopes she can offer some clues to the dog's strange condition.
No lameness that you've noticed recently with her, or any trouble getting around? Struggling to stand or walk for a long period?
Never. And she's been very athletic. She's a very active, healthy dog. I have no idea. There's no reason why.
She doesn't have what we call conscious proprioception, okay? So it's sort of the ability to know where your limbs are in space and kind of be able to put them down. So, the question is, why is she doing that? And I don't know yet. We need to do a further neurological exam. I want to test her reflex.
Okay.
Okay?
Rosie's history offers no clues to what's causing her paralysis, so Eric does a more thorough neurological exam. What he finds is shocking.
It was pretty surprising. What I could tell right away was that Rosie had absolutely no reflexes. For it to be that profound where she had no neurologic function in all 4 of her limbs meant that she had a systemic or full body disease going on. It was something wrong with her entire nervous system.
Eric now knows a disease is attacking Rosie's nervous system. The question is, which disease?
It's all right.
Let's draw blood.
In the ER, Dr. Kevin Drygas is doing follow-up on a case that's been bothering him all week.
What's his name?
Duke Valdez, come here, buddy.
Duke is an 11-month-old boxer with a history of eating things he shouldn't.
About 7 days ago, Duke came in for vomiting, and the owners thought that he had gotten into a little bit of glue, actually, and that he had just an upset stomach. We took radiographs of his belly. He's got a big gas-filled stomach, but no obstructive pattern. The bad news is, about 10 minutes after this radiograph, Duke vomited up 2 pieces of a chewed-up tennis ball. So it just goes to show you that not everything is foolproof. Just because you take a radiograph doesn't mean you're going to absolutely see if there's something in the stomach. And that was a good lesson to learn, because There's a tennis ball in here right now, and there's no way to see that. So we went ahead and sent him home on some GI medicine, and it's been 6.5 days now, and he's vomiting more, and he's actually getting pretty sick. Buddy, what did you eat? Did you find anything else in the house that maybe he could have gotten into?
No, I still keep going back to the glue.
Glue? How much do you think he got? How much do you think he ate?
I don't know. My brothers found it actually in the garage, and there was glue on the carpet.
Okay. This is a hard case.
Yeah.
This is a hard case. He's actually showing signs of getting worse. So the sense of urgency that I feel right now is growing by the minute.
Kevin believes there are two main possibilities. Either Duke still has a foreign body in his belly and he's obstructed, or else the glue he ate was toxic and has damaged his stomach.
The next step, in my opinion, is to do a barium series.
Dr. Drygas will have Duke swallow a liquid called barium, which shows up on x-rays. Over the next 4 hours, a series of radiographs will show if the liquid moves through Duke's system. If the barium stays in Duke's stomach, it will indicate Duke has an obstruction and needs surgery.
I'm a little nervous because now this is something that's potentially been going on a week and could be more serious than it was initially. I guess we'll just wait on him to make our final assessment. But right now, I'm a little nervous for Duke.
These young people have done a very good job of getting midway, but challenges only get bigger as they move forward. There's no downhill coast. We want them to continue to climb up the mountain for as long as they're here.
Today, Dr. Eric Anderson is trying to diagnose the cause of a child's mysterious paralysis. And in radiology, Dr. Kevin Drygas is experiencing a puzzling case of his own. He's running a barium series on Duke, the boxer puppy who he suspects ate superglue.
When you take the radiograph, the barium lights up so you can see the barium, you can see exactly where it goes.
Over the course of 4 hours, Kevin will follow the barium through Duke's digestive system. If it stays in the stomach, it means Duke is obstructed by a foreign body that he swallowed and will need surgery.
I would love to see it fill the stomach and pass out. But then that would leave me with a dog that's vomiting, and I don't know why. It's kind of a mind game, some of these cases. Number one, you've got a client who's giving you a history of a bright, alert, responsive dog, healthy at home, who's just vomiting. That can be anything. Your gut tells you it's probably a foreign body, but thinking about all the other possibilities that can cause vomiting, thinking of all the different variables in the equation, you don't want to do anything unnecessary. To do the best thing at the right time sometimes is the hardest decision.
But after 4 hours of x-rays, Kevin is left with a confusing result.
This case continues to frustrate me because it's not doing what the textbooks say it should do. You have this gastric mass, potentially mass, that looks to be taking up contrast, but at the same time, the stomach's empty, so you don't have a complete obstruction. So right now it's not clear cut.
Most of the barium is passing into the intestines, suggesting Duke is not obstructed. But at the same time, some of the barium is staying in the stomach, suggesting there is a blockage. It's a contradictory result.
I've got a question on a barium series. I just want to get your opinion.
So Kevin calls on surgeon Rainier Coe for a consultation. But unfortunately, the radiographs don't tell Dr. Coe any more than they tell Kevin.
Like, it looks like it's getting out of there, leaving. That's like how the stomach looks, right? When it's emptying and getting all gone. But it's not. That same pattern has been there the whole time.
This is the life as a doctor, man. You have to make these calls.
Yeah. That's when I kind of looked to him and I said, you know what? Every intern that goes through this program, they have to grow up one of these days. I want to put him in the driver's seat, and that's an important thing to do.
Then you make the call. And I'll support you whichever way.
Whenever somebody says to you, it's in your hands, you make the call, there is a whole new level of responsibility and realization that the buck stops with you. It's time to get off the fence, basically, and make a decision.
Let's see, you gonna get up, sweetie?
In neurology, Dr. Eric Anderson has come in on his day off to consult with Dr. Paul Cudden about Rosie, an 8-year-old chow mix who can't move her legs. Eric believes some sort of disease is affecting her body and causing the paralysis.
Dr. Cudden's got obviously a lot more experience in this, and hopefully help, confirm the diagnosis and talk about, legitimate treatment for her.
No obvious spinal pain. Patellar reflex is 0. 0. She fits perfectly with a generalized lower motor neuron disease.
Yeah.
So your suggestions on your differentials were correct. I would say Kuhnhound paralysis would be number 1.
She was pretty suspicious for a disease that we call Kuhnhound paralysis.
Kuhnhound paralysis implies that there has been some contact with raccoon, and typically raccoon saliva, where there is a foreign substance within that saliva that the immune system of the dog reacts with, then starts attacking the peripheral nerves in the dog's body.
As a result of the disease, Rosie's immune system has become overactive and is now attacking her own body, causing the severe nerve damage.
Unfortunately, once the damage to the nerves occurs, we cannot reverse the damage that has already occurred.
There's no cure for the disease, so Eric and Dr. Cudden's